Welcome to Sunshine Science. Our mission is to alert the public on the dangers of insufficient sun exposure to your health. America's second largest public health problem is insufficient sun exposure. It's responsible for 340,000 preventable deaths per year. Adequate sunshine should be incorporated into daily routines in order to become healthier and increase life expectancy. That's why the Sunshine Health Foundation is committed to alleviating this severe health problem. Our world-renowned scientists provide public health officials with research on the benefits and risks of sun exposure. If you're ready to build healthier communities, then let's get started.
Did you know that there's a connection between the melanin in our skin, racial health disparities, and sun exposure? Yep. Modern science provides evidence that, one, much of the health disparity we see between Black and white Americans might be linked to the fact that we Black Americans have more melanin in our skin. And two, more sun exposure by Black Americans might play a role in significantly reducing health disparities across a variety of diseases and health conditions. From asthma to Alzheimer's, Black Americans suffer from the ill effects of insufficient sun exposure far more than white Americans. While our melanin suited our ancestors well in the strong tropical sun of Africa, it's just not as well suited for the weaker sun of most of the United States. This is because our darker skin has a larger amount of melanin, and melanin blocks some of the sun's rays. With our melanin blocking the sun's rays, it's not surprising that Black Americans therefore need more sun exposure than white Americans to reap the health benefits. And studies show there's a connection between limited sun exposure, vitamin D deficiency, and the enormous health disparities we see between Black and white Americans. They say knowledge is power. And at Sunshine Science, we believe that if more Black Americans were aware of the existence and power of this science, we would be more empowered as individuals and as a population to improve our health and increase our life expectancy by getting our vitamin D levels tested and getting more sun. Enough sun to bring our vitamin D levels up to 30 nanograms per milliliter. And this is something that could be accomplished relatively quickly. Now, to be sure, I'm not implying that more sun exposure will eliminate all or even most of the health disparities we see, many of which are the result of inequities across the social, behavioral, and environmental determinants of health that we've discussed in an earlier episode of Sunshine Science. But knowledge is power. And so today, on this episode of Sunshine Science, I'm going to drop some knowledge through the lens of 14 diseases and health conditions, all of which have a disproportionate impact on Black Americans. We will explore the state of racial health disparities and the role that sun exposure might play in reducing them and in improving health outcomes for Black Americans. So much of what I'll share with you in this episode has been intentionally kept out of public health messaging and has been blocked by dermatologists, sunscreen companies, cosmetic companies, and others with an economic interest in perpetuating fear of the sun. And sadly, while other countries are sharing this information with their Black citizens, the U.S. government is not bringing this knowledge to Black Americans, either through their Healthy People initiatives or even the health information on their websites. So today is our opportunity to learn. So let's get started. First, did you know that in 2003, scientists found that insufficient sun exposure increased the risk of multiple sclerosis by 100%? 100%. Now, this is a significant health disparity issue because we know that the incidence of multiple sclerosis is 47% higher in Black Americans than in white Americans. In fact, minority populations from various backgrounds in the United States have a higher incidence of multiple sclerosis compared with their ancestral countries of origin. And insufficient sun exposure has been proven to play a role in this racial health disparity. Number two, it's also been shown that insufficient sun exposure increases the risk of colon cancer by 104%. We see this play out as a health disparity in that for Black Americans, the incidence of colon cancer is 19% higher than whites. And when it comes to mortality, studies show that Black Americans are 145% more likely to die from colon cancer than white Americans. Number 3, since as early as 2009, scientists have found that insufficient sun exposure increases the risk of high blood pressure. And this has a significant impact on Black American health because the incidence of hypertension is 37% higher in Black Americans than in white Americans. Hypertension-related death is 4 to 5 times more likely in Black Americans than in our white counterparts. And Black women, we're more than 60% more likely to have high blood pressure than white women in this country. Sufficient sun exposure could be critical in shrinking that racial disparity gap. Number 4, I bet you didn't know that when pregnant women and infants do not get sufficient sun exposure, studies find there's an increase in the risk of sudden infant death syndrome, or SIDS. Yep, this was discovered in 2013. And we see racial health disparities in SIDS rates too. SIDS rates of Black babies are more than twice of those of white babies. Number 5, insufficient sun exposure increases the risk of type 2 diabetes by 35%. This was discovered in 2013, and this matters for Black Americans because statistics show that the incidence of type 2 diabetes is 56% higher in Black Americans than in white Americans, and we're twice as likely to die from it. This brings us to number 6. In 2013, it was discovered that insufficient sun exposure increases the risk of stroke by a staggering 82%. Why does this matter when it comes to health disparities? Well, Black Americans are 50% more likely to have a stroke than white Americans. Black women are twice as likely to have a stroke as white women, and our men are more than 70% more likely to die from a stroke as compared to white men. Number 7, insufficient sun exposure also increases the risk of rheumatoid arthritis by 27%. And this relates to health disparities because the incidence of rheumatoid arthritis in Black American men is 70% higher than in white American men. And in Black American women, it is 100% higher than in our white counterparts. Number 8, insufficient sun exposure shortens life expectancy. Now, it's important to note that Black Americans already had a 3.5-year shorter life expectancy than white Americans. And for Black men, life expectancy has actually decreased by an additional year due to the COVID-19 pandemic. But there's a 2014 study that found a relationship between life expectancy and sun exposure. And they found in that study that 12.8% of US deaths, approximately 340,000 deaths per year, were attributable to insufficient sun exposure. Now, not surprisingly, the study didn't break this figure down by race. I mean, the reality is lack of race-specific health data is also a significant contributor to racial health disparities in this country, but that's a conversation for another episode. But like most health conditions, it is probable that these deaths associated with insufficient sun exposure disproportionately impacted Black Americans. And that brings us to number 9. Did you know that insufficient sun exposure increases the risk of Alzheimer's by 122%? This too was discovered in 2014. And the incidence of Alzheimer's disease in Black Americans, it's 100% higher than what is found in white Americans. Number 10, insufficient sun exposure also increases the risk of asthma, which occurs in Black Americans at rates 40% higher than those in white Americans. And the mortality rate for Black Americans with asthma is 200% higher than for white Americans. Black children are 5 times more likely to be admitted to the hospital for asthma than white children. Number 11, insufficient sun exposure also increases the risk of obesity. And for Black Americans, this matters because the incidence of obesity is 18% higher for us than for white Americans. Number 12, pregnant women take note. Insufficient sun exposure increases the risk of premature birth by more than 130%. This was discovered in 2016. In fact, infants born to Black mothers are 3 times more likely to die from complications related to low birth weight as compared to infants born to white mothers. Number 13. It was discovered in 2017 that insufficient sun exposure increases the risk of incidence and mortality from stomach cancer. And this matters because Black American men are 1.7 times more likely to have stomach cancer as white American men and are 2.5 times more likely to die from it. Black American women are twice as likely to have stomach cancer as white women and are 2.2 times as likely to die from it. And finally, number 14. Recent studies show that insufficient sun exposure increases the risk of incidence and mortality from COVID-19. We know that Black Americans have been disproportionately impacted by the pandemic, but the numbers really serve to highlight the disparities. Black Americans are 2.8 times more likely to be hospitalized for COVID-19 as white Americans, and 2 times as likely to die from it. So what if simply getting more sun exposure could reduce these racial health disparities? Studies show it can. Certainly, sun exposure is only one of many determinants of our health. A significant one, but only one. To eliminate racial health disparities, we must not only encourage sun exposure, but also create fair and just opportunities for all of us, not just some of us, all of us to be healthier. This necessarily requires removing obstacles such as racism, discrimination, poverty, and their consequences, including disenfranchisement, a lack of a sense of belonging, lack of access to good jobs with fair and equal pay, quality education, housing, safe environments, equitable healthcare. And it requires addressing and removing biased, inequitable messaging around sun exposure. Messaging that is meant to protect white Americans, but misguidedly applied to Black and white Americans alike. Now, I know I've thrown a lot of numbers and statistics at you in this episode, but what I've offered in this episode of Sunshine Science is really just a snippet of the role of sun exposure in reducing health disparities. But I can hear you asking, okay, Muntrice, but what do I do with all this data? On a practical level, how can I use this information to empower myself and my family to get sufficient sun exposure for our health? Well, I'm glad you asked. The solution for Black Americans is to get enough sun exposure to get our vitamin D levels up to 30 nanograms per milliliter on the standard vitamin D blood test. 95% of the Black American population currently have lower than that. So the first step is to get a standard vitamin D blood test from your doctor. If your vitamin D level is below 30 nanograms per milliliter, you need more sun exposure to avoid the poor health resulting from insufficient sun exposure. This may require that you lie out in the sun whenever you can, in addition to spending as much time outdoors as you can. It helps to expose as much of your skin as possible to the sun. If you're concerned about getting too much sun exposure on your face when lying out in the sun, just cover your face with a white towel. Keep in mind, the benefits of the sun are proportional to the area of your skin exposed to the sun. So covering your face is okay if your legs and arms are exposed. But get some sun. Because as we've learned in this episode of Sunshine Science, sun exposure has a profound effect on health outcomes and has a huge potential to reduce racial health disparities. This means that there is the potential for thousands of lives to be saved by sharing the knowledge of modern science and by encouraging Black Americans to get daily sensible sun exposure for our health.
Thank you for listening to today's episode. If you're ready to build healthier communities, please visit sunshinehealthfoundation.org to find the latest research on the health benefits and risks of sun exposure. Or you can subscribe to our newsletter for our latest updates. Step out of the dark and embrace sunshine. Let's build healthier communities.